There is new research from the American Association of Cancer Research found women living in poverty are significantly more likely to develop and die from cervical cancer, even though it's apparently one of the most preventable forms of cancer. We're joined now by Dr. Rebecca Perkins, who is an OB/GYN at Tufts Medical Center, to help explain what this means. Doctor, thank you so much for talking about this really important subject. This is a report that found cervical cancer deaths are nearly 50% higher among women living in poverty. Why are we seeing such a large disparity? How is that still a thing?
So the reason we see the disparity is because cervical cancer is almost entirely preventable with HPV vaccination in childhood and screening in adulthood. So when we see differences by income, it's because the people who are getting cancer don't have access to the prevention tools that they need.
So you're saying that screening is critical, and you're saying going to the doctor and those things can really make the difference. But if they don't have access to that, that's why we're seeing these numbers. For someone watching at home, what are the most important steps that they can take to prevent cervical cancer?
So there are two steps. One is if you are a woman with a cervix, a person with a cervix, you need to go to your doctor and get screened with a pap test and an HPV test. And if you are a parent or have a child in your life, getting them the HPV vaccine between the ages of 9 and 12 is critical, because a new study from England showed that it prevented 100% of cervical cancers before the age of 30.
Wow, that's quite a statistic. I mean, 100%, there you go right there. If someone has put off their pap test or HPV screening because of a cost, because of time, or fear, what do you want them to know today?
The most important thing to do is to make it in and to get screened. It's easy, it's quick, it shouldn't be too uncomfortable. And the most common reason we see in people who develop cervical cancer is that they didn't think they needed screening. So if you are between the ages of 21 and 65, you do need screening. Everybody needs screening, because you don't know that there's a problem until there's a really big problem. But screening can detect anything before any symptoms develop, and then the treatment is over 90% effective to prevent you from ever getting cancer.
And it can save your life.
100%.
Dr. Perkins, thanks so much for your time and your wisdom. We appreciate it.
Thank you.